All right. Greetings, everyone. Thank you so much for giving me the opportunity to talk about a topic that I'm very, very passionate about. So, virtual hospitals. Uh, and we're going to be using virtual hospitals, telemedicine, telehealth services, all as interchangeable terms throughout the talk. So I'm going to be talking about revolutionizing healthcare delivery through virtual hospitals. My name is Shangwe Kiliaki. I currently practice as a nurse practitioner in hospital internal medicine at Mayo Clinic in Rochester, Minnesota. So let's go ahead and get started. So I have nothing to disclose other than, again, my passion for telemedicine and telehealth. Some of the things we're going to be talking about today will be the general terminology and definitions related to telehealth. We'll talk a little bit about Mayo Clinic, integration of physical and virtual care, how nurses play a role in the virtual hospital space, how interprofessional work looks like in a virtual hospital, what are some of the benefits and challenges of virtual hospitals, and what does the future look like? So let's get started with some virtual terminology and definitions related to virtual hospitals. What do we mean when we talk about virtual hospitals? Really, we're talking about the ability to provide clinical services to patients in their homes or other environments that are not hospitals or clinics, so other non-brick and mortar environments, using technology through things like platforms, remote patient monitoring devices, mobile applications, and the patient's health records to provide those clinical services. What do we mean by telehealth platforms? Well, these are things like the platforms that enable us to do remote consultations, so actually interact with the patient remotely, be able to send messages securely, and provide remote monitoring. So these are the platforms that enable us to have those virtual interactions with patients. What are remote monitoring devices? These are things like scales, thermometers to get the patient's temperature, blood pressure monitor or cuff to get the patient's blood pressure. You can have the oximeter to measure their oxygen requirements. Those are all devices that can be sent home with the patient. They capture the patient information and health metrics in real time, and that information gets transmitted to dashboards or their health records, and the care team is then able to see that information and react to that information in real time as well. What are mobile applications? Well, we all use mobile apps, right? So if some of you are really into fitness and nutrition and you have certain apps that you use to keep track of your activity levels or your dietary intakes, these are the same similar types of applications that patients can use to access their health information and then facilitate communication with their care teams. And then what is an electronic health record? Well, that's the system that stores all of the patient information securely and then help streamline that data sharing between health providers and sometimes even between health systems if a patient is seeing at different health systems. So here at Mayo, everything that has to do with digital transformation goes through the Center for Digital Health, or CDH. So this is really Mayo Clinic's hub for digital transformation, and they work across all of the Mayo Clinic sites and platforms to give us digital solutions that help not only Mayo Clinic's patients, but also Mayo Clinic staff members with anything to do with data and digital initiatives. They are also experts in addressing problems that can be solved with digital data, analytics, artificial intelligence, machine learning solutions. All of those solutions are usually generated through the work that CDH does. So let's talk a little bit about Mayo Clinic. So Mayo Clinic is the largest integrated not-for-profit medical group practice in the world and committed to clinical practice, education, and research, providing whole person care to everyone who needs healing. We are a large institution. There's about 83,000 staff that care for patients from every state in the country, as well as patients from over 135 countries in the world. So these patients visit all of our different Mayo Clinic sites per year. So we have a lot of patients from a lot of countries, which is always very exciting. Our headquarters are in Minnesota, but we have campuses in Arizona and Florida, and then we have the Mayo Clinic Health System community hospitals and clinics, which are smaller clinics and hospitals throughout Minnesota, as well as the neighboring state of Wisconsin. In 2024 alone, Mayo Clinic did more than 1 million outpatient digital appointments. That's a lot of appointments. So virtual care is huge at Mayo. So 1 million outpatient digital appointments. This was an increase of more than 17% from the year prior. So what does the integration of physical and virtual care look like? And this is a very busy infographic, but I hope I will be able to make it less confusing for you. So I have kind of the different arrows all pointing towards, eventually pointing towards virtual care, showing how these different areas are connected, but also how they work and how they lead to virtual care appointments. So, and I hope you can see my pointer. Starting at home, if a patient is at home, they can actually directly get a virtual care appointment, whether it's a new patient to Mayo Clinic or an established patient. They can get scheduled for a virtual appointment as a screening appointment. So if a patient is calling in because they want to establish care, for instance, with Mayo Clinic, they can get scheduled for a virtual appointment so they can go through the initial screening questions so that the appropriate appointment with the appropriate provider can be scheduled. Or if they are an established patient and they just had questions or they're not feeling well, they have some symptoms, if they called the clinic, they could get scheduled for a virtual appointment as they're waiting for maybe an in-person appointment. Okay. Alternatively, that patient could get seen as an outpatient. So outpatient are appointments in the clinic, not in the hospital, but in the clinic. They could get seen by their primary care doctor. And based on how that appointment goes, their primary care doctor might decide to schedule a follow-up virtual visit after that appointment, or if they feel like that patient needs to be seen by a specialty provider, so maybe a kidney doctor or a heart doctor, they might schedule them for a virtual appointment with that specialty provider before the patient actually sees that provider in person. Another alternative could be that a patient goes from home to the emergency department because they're not feeling well. They might get the evaluation in the emergency department and actually get discharged from the emergency department back home. And they can get set up for a virtual visit that can follow up on their emergency department visit. So that's another alternative. Or they could go from an emergency department, maybe they were too sick to get discharged from the emergency department. They would then get hospitalized. And there are some virtual services that we do within the hospital, which we'll talk about in a little bit. But if they are in the hospital, they get discharged from the hospital, they can get scheduled for a virtual appointment to follow up on their how they're doing after their hospital stay. Or if they get discharged from the hospital, but they're not ready to go home, or they're just needing more services at home because they're not back to their baseline, then they go into this transitional care space, where sometimes this means that they go home with additional services like home health services or physical therapy, occupational therapy, or they can go to a rehab facility to get stronger before going home. We also can schedule appointments, virtual care appointments with them during this transitional care stage, and they can get those visits as well. So there are so many scenarios in which virtual care is utilized or virtual hospitals are utilized. And hopefully that makes you understand why we had over 1 million appointments just in 2024 in terms of digital appointments at Mayo Clinic. Just to break down things a little bit more, again, looking at the outpatient space, inpatient space, which is in the hospital. Outpatient is outside of the hospital, but in the clinics, outside of the hospital clinics. And then transitional care space, that space between being discharged from the hospital and going back home, or going back home with additional services. So outpatient, how is the, and these are numbers in terms of digital footprint, enterprise-wide digital footprint as of 2023. How are digital services utilized in these different settings? So in the outpatient setting, we are able to do mobile. So patients are able to do mobile appointment check-ins through their own mobile devices, or we have tablets with check-in kiosks where patients can check in themselves for their in-person outpatient appointments, which really helps cut that waiting line down in the clinics. So they're not waiting for somebody to check them in. They're able to do that themselves. And then again, as previously discussed, there are some specialty services, actually quite a few specialty services that offer video visits to patients, so they can have those visits from home before they're seeing in person, or they can also have those visits as a follow-up appointment to their in-person appointments. In the inpatient setting, so in the hospital, we have several care teams that utilize video services to provide care. A good example of this was during the COVID pandemic. Instead of having infectious disease doctors going into the patient's rooms, they used to just do video visits, dial into the patient's rooms, and provide care that way. And actually, we also did that. My team members and I also utilized a lot of video visits during COVID to do that. And some of that is still continuing now, obviously not COVID specific, but teams like diabetes educators, they can use some tablets or screens that are in patients' rooms, and they dial in and they're able to interact with the patient. We also have some viewing cameras in different rooms, and this one is infant, but we have infant viewing cameras, we have adult viewing cameras that we'll talk about here in a little bit. And then we also have the tablets. These are the tablets that we use to remote in and interact with patients. But now we're starting to move away from the tablets and actually having screens that are mounted on the wall. And I'll show you a picture of that here in a few slides later. And then the transitional care space, we do remote patient monitoring. So those devices that can capture real-time health metrics, and that information gets transmitted, and we are able to view that from a dashboard or their health records somewhere far from the patient. The patient is at home, we are in the hospital, we're able to see that information. So what are some of the professions that are currently working in the Mayo Clinic